Hello, Chris, and welcome to the Through a Therapist Eyes podcast.
Hey, Mr. Graves, good to see you again, man. I got to say, I love being back on the mics. This is kind of cool as life gets back to normal, at least the new normal, right? So we are inviting you to see the world through the lens of a mental health and substance abuse therapist with the goal to create emotional growth through the medium of this podcast. Everyone being aware, as always, this is not the delivery of therapy services in any way, and we're looking for feedback and discussion. You can always go to throughatherapist'seyes.com. Mr. Graves, this is the human emotional experience. What shall we do?
Figure it out together.
I love it, man. You are Coach Graves, pointing that out. He's an unbeatable mind coach, developing that program and services for people. Pretty cool. Still going well?
It's going good.
That's good.
It's going good. Lots of good stuff happening.
Thank you to everybody out there for the feedback and everything on the book cover. We have come to somewhat of a collusion. We've colluded to come to a conclusion on the book cover, but that's going to remain a mystery. God, it's been such a crazy process to try to figure out, man. I ain't gonna lie. We got a Google of people today on the show, Mr. Graves. We've had quite a few guests lately, have we not?
We have. We got multiple people on today. It's the first time we've had this many, I think.
I agree. I was thinking about that.
Yeah, it is.
I was thinking about that. Well, we got 1, 2, 3, 4, 5, right?
Including me and you, yeah.
Yeah, pretty neat. We are talking about the national. Did you know there's an epidemic going on?
I heard something about it.
Did you?
Yeah.
Yeah.
Something about it in the news.
COVID-19, my gosh. Senior long-term care plight has been just a dynamic issue that people have been talking about, worried about, thinking about. It's. I think we're going to blow your socks off a little bit with some of the things that we're going to talk about today with how people are experiencing the nursing care facilities and stuff. Craig, is this our second I guess this is our last COVID-19 specific episode. Is that a true statement?
This is the last one we have planned. There may be follow-ups, but this is the last one we have planned for now.
Well, we got a summary coming next week, and and then we're playing around with taking a little bit of a break. So we'll see how all that goes. Yeah, there's so many things happening in rapid fashion. So guess who we got on the show today? Do you know?
I know.
You do know. He's cheating, everybody. He's got show notes. Listen to this guy, man. Craig, Mr. Richard Danford has been willing to join us. This guy is, as I have come to find in the last couple of weeks talking to him a few times, passionately and tirelessly served as a successful patient rights advocate, a long-term care facility ombudsman. He's been a champion for the aging disabilities populations in 4 states over 25 years, previously at the New York City long-term care ombudsman program, first at the Brooklyn Borough, supervising, and then as program director was responsible for implementing long-term care ombudsman required for the Older Americans Act. I don't know what that is, but maybe we'll find out. He provided program administration, operations, and training of supervision of team professionals and volunteer ombudsmen responsible for serving over, Craig, listen, 50,000 residents in 240 long-term care facilities. This guy's been around, I'd say.
Wow.
I ain't done. He is currently the advocate chair for the National Association of Long-Term Care Ombudsmen and consultant to nonprofit organizations serving the aging and disability communities in Massachusetts and New Hampshire. Previously director of patient advocacy program at the University of San Diego Law School for 15 years. Are you doing the math on this guy? President of the California Association of Mental Health Patients' Rights Advocates, former California Advocate of the Year and Mental Health Person of the Year for San Diego County. Covered the whole 50 state thing, I'm thinking. He also served as long-term care policy and procedural process engineer and community development specialist for the state of Idaho. Mr. Danford, thank you for what you clearly are very accomplished and have been doing for just a minute, for all that you have done for our seniors, sir. How are you?
Good. It's kind of hard to listen to all that. It just makes me feel older. But anyway, yeah, it's great to be here. Really appreciate you guys being interested in this subject for sure.
Absolutely. It's funny. Somebody told me, actually, I think last week, Mandy did. She's like, it's kind of funny, man. When you hear your intro go past a minute, it's kind of like, oh, God.
Yeah, yes. You got to be an old guy then. You know what's interesting about this? I don't know. I think I sent you an email to that effect. My roots are actually in the therapy area.
Oh, okay.
Yeah, I graduated right after undergraduate school. My degree was in psychology, and I had this fantasy that I was going to be the next Carl Rogers.
Gotcha.
Yeah, it didn't quite happen. And right out of school, I started working in psychiatric intensive care units, and quickly realized that the system of care, if you will, was a whole lot different than the theoretical conversations about approaches to doing therapy. Long
Right.
story short, after 6 years of working in psych ICUs, I became a patient rights advocate in response to that. So yeah, my roots are in that area, but yeah, I never made it to the Carl Rogers perfection level.
Well, you know what's funny? Shall I call you Mr. Danford or Richard? How shall I?
Yeah, yeah.
Okay. So you know what's funny? I don't talk about this much, and because I barely remember. It seems like so long ago. But one of the very first professional experiences I ever had was as I had to do volunteer hours as a part of getting in, or actually maybe as just early on in my undergraduate BSW career. I spent time in an adult daycare facility. That's what they called it.
Yeah.
So that's fascinating. Craig, we're not done. We got a couple more people. We got we're gonna protect identities a little bit and they wanted to be referred to as Dr. B and Dr. A, and they have been for a long-standing as staunch advocates of the voiceless and the vulnerable residents that we have across our country. They have a loved one in a facility currently. And I'm not sure if you guys wanted to say what state that is in, so I'm going to withhold that out, but it might be interesting for people to know. Welcome all three of you to Through a Therapist's Eyes. Let's, Dr. A and Dr. B, how about you introduce yourself a little bit and tell us a little bit about what you want to say?
Good afternoon, good evening. We are concerned about the residents who are in the nursing homes, not only in our state, but across the nation. We recognize that our senior citizens, our most vulnerable demographics, are not being treated very well. And because we have a parent who is now in a facility, she is a centenarian, and we are certainly concerned about her health and also the people who are in her residential community.
Are you saying she's lived 100 years?
Plus.
Wow. That's amazing.
That is super cool.
and she's cogent, and she's funny. She has all her teeth. Her eyes are excellent. No diabetes.
That's fantastic.
No
Hey, you mentioned teeth. Craig likes to throw a joke at me, man. He drives me nuts every time he talks about my home state of West Virginia. You maybe, Craig, I set you up, man. You want to do it again? Go ahead for the 20th time.
So how do we know the toothbrush was invented in West Virginia?
Please tell me how. Why?
Wait. Otherwise, it would have been called the teeth brush.
There's the punchline. He loves to just jab me, man, but I'm proud of my teeth from West Virginia.
That's right.
Listen, guys, whomever we open this up to, I was curious. I got some questions and stuff, and I got some thoughts that we kind of maybe go down through after we go through some questions. But I wanted to just open it up really for any three of you, right? Like the idea of you guys absolutely living this right now and experiencing this with, with your parent is fascinating to me and absolutely powerful. And Richard, your incredible experience over really, man, like, dude, the whole country in your advocacy as an ombudsman. My question is, what is the real story, right? What are you experiencing right now as a family member or an ombudsman with residential care and the COVID-19 deal?
Well, maybe I'll go first because I want to give the doctors as much time as they'd like to respond to this. But I think the important thing to realize, and that I hope that your listeners and viewers can get a sense of, is the catastrophes that are occurring as a result of COVID-19 in the nursing home setting is certainly unprecedented without a doubt. But a lot of the problems that are occurring, it's just illuminating conditions and circumstances that pre-existed the virus. The fact that nursing homes have never really been given the attention that they deserve, or not just nursing homes, but the whole population of aging and disabilities. As a country, we live in denial about getting older, period. And we don't want to talk about it, and we don't want to spend money on it, and we don't want to develop programs that are appropriate for those people in that category. And so what was going on in nursing homes was the problems predated COVID-19. COVID-19 is just like throwing gasoline on the fire, no question about it.
Yeah, let me highlight that. You just said that it is predated, really.
Yeah.
The problems that we're having now are just magnified and made louder, but this is all really kind of predating everything we're dealing with now, huh?
It absolutely is. Yeah. You can get into some of the details there, but to kind of set the stage, I think there's a tendency for people to think that the virus itself and what's occurred and the reactions to it define what we're talking about, and it's really just part of a much bigger subject.
Right.
I'll let
ladies
respond.
Ladies, what are you thinking, man? What's the real story? And is it? But let me get clear too, because I know you're wanting to protect the identity a little bit of the facility and stuff. Is the location okay to say?
Yes, we are in New York.
Yeah, man. I mean, you're in the epicenter, right? I mean, that's what's so powerful. Like, this is really like right in the heart of where we've really gotten hit. What's really going on? What's the story?
Well, we're looking at a group of people who have been exposed to the COVID, and it's been unjust. And I think that what we're looking at is genocide and extermination of a demographic group. We're looking at ageism and classism, neocolonialism. We're looking at a range of isms. And it's unfortunate that our senior citizens have been basically put into the ash heaps. And a lot of these issues and the deaths did not come from family members. It came from the staff people who cross-contaminated. They refused to let the family members in. And so what did you have? You had people's loss of identity, the abandonment, isolation, lack of safety and well-being, and people were heartbroken. So in addition to comorbidity and all of these other mental health issues and an aboundment of dehydration and now malnutrition, some of the people refused to eat, stopped eating. So we began to see a range of issues that were imposed on a group, an innocent group. And this is a sad day, a sad era for nursing homes.
Wow. Yeah, that's pretty sobering. That's crazy.
I think also you cannot repair the wounds of isolation and intentional involuntary seclusion that the residents were subjected to once this started as what we called an essential visitor and active family. We went to see our mother 365 days a year, sometimes twice a day, and sometimes 3 times a day, because we constantly monitored her health, her treatment, and care. And most of the time we went in there and we helped her with her dinner. We also were giving her vitamins and giving her things to, make sure that she stayed well. And, she has not had those kinds of supplements since we stopped seeing her. And so we expected there to be a difference. And I think after a total of 91 days, a lot of people in the nursing homes have been subjected to the loneliness and the isolation and the essential touch that close family members, essential family members, have been able to provide to someone such as our mother. Yeah. And it's been very, very difficult. We talked about the faculty, the staff did not have appropriate PPEs. And so we reached out to get the elected officials to bring PPEs into the nursing home and to different nursing homes in New York. And some of the corporations did not want the faculty to even the staff to wear the PPEs. So you wonder what is going on if the corporation hasn't given the staff members PPEs, then where should they get the necessary equipment that they should wear so that they don't contaminate themselves and they don't contaminate the residents? Certainly the family members didn't contaminate any of the residents because we weren't allowed in.
Yeah, if I could kind of add to the my initial comments about how this response is kind of indicative to our whole approach to aging and is definitely to long-term care. Deaths in nursing homes and in long-term care facilities in some states are over half of all the deaths in the states. Nationally, I think it's at least 30%, if not more, maybe 40% of all the deaths. And nevertheless, you look at, and let's use New York as an example, once the virus was starting to spread, they did outrageous kinds of things. I mean, outrageous meaning extreme measures of bringing in the Navy shift print DC, of taking over the Javits Center and putting hundreds of beds in, building temporary beds in Central Park itself, for instance, doing major daily press conferences talking about the impact in the hospitals and that sort of thing. And during that same period of time, there was almost no attention being paid to the nursing homes. No PPE conversations. All they did was they eliminated a number of regulations that normally protect patient rights or resident rights, like they allowed for people to be transferred from one facility to the next without even telling the family or the resident that was going to happen. They isolated people.
Whoa.
They isolated people in their rooms against their will, which under any other circumstances requires a whole set of clinical conditions that some of your mental health people probably know, and observations that are enhanced, which didn't occur. They couldn't eat together. People that couldn't feed themselves were being left isolated in their room, and maybe not even enough staff. Anyway, I could go on and on and on about the kinds of problems, but the lack of any kind of direct response to do anything about what was happening in nursing homes other than lock them down was appalling, in my opinion. It's still appalling that the federal government finally came out like maybe 2 weeks ago with a plan to provide PPE to nursing homes. And the plan was to provide 2 weeks of supply and to each nursing facility and deliver them by July 1st. Unbelievable.
I'm gonna be honest with you guys. I'm sitting here and I'm just listening, and I would say, you know, in my therapy offices, you know, in sessions, I've definitely worked with. I'm working right now with an elderly person, and I've definitely come across the elderly population issues, but I wouldn't call it one of my strongest areas. I am kind of, as people listening have found out, I'm a talkative person. Anybody that knows me knows I got a lot to say. You guys are talking about some of these things, and I'm just going to be genuine with you and tell you my emotion. Like, I'm Craig, dude, like I'm kind of becoming a little bit speechless. I don't, let me check in with you. What you thinking? Cause I'm just kind of like, wow.
Yeah. Same thing. You know, definitely the elderly population is obviously most at risk from this thing. So it seems to me that more attention and planning would have been put into protecting that segment of the population, especially in rest homes where, you know, people are gathered together in close quarters.
I mean, seriously. Yeah. And, you know, and Dr. B or Dr. A, when you were talking, I mean, you know, one of the things that made this show, Craig, so powerful to me in realizing and thinking about this part of the epidemic reality. I mean, you got to think about this. I mean, you know, we're all across the country. I mean, we're all sitting here like, you know, sick of seeing our houses and what's it called when you got cabin fever and all. I mean, can you imagine being in a 40 by 40 foot room and not really being able to come out your room and people bringing meals to you? Like is that how it really has been? That's why I asked, like, what's the real story here? Is that really what's going on? Like, yo.
Right. Try a 10 by 10 room, not a 40 by 40.
Okay, please, at least a window, right?
Yeah. Yeah. Some have windows. Like I do need to throw one more thing in, and then I'll try not to dominate the conversation. But because I represent the ombudsman role, and I'm the advocacy chair for the National Association of Local Programs, ombudsman, our role ongoingly is to investigate complaints from residents and family members, to try to seek resolution to those complaints. And those include everything from abuse and neglect to care plan disputes to contesting transfers and discharge, like I mentioned earlier.
Right.
A whole array of different things that enhance the quality of the environment itself and protect people's rights and their quality of care. And the response from the federal government immediately when they locked down the facilities was to categorize the role of the long-term care ombudsman as non-essential personnel. So where our job is to visit each facility on a regular basis and know what's going on with the residents and know how to problem solve and make sure that nothing bad is occurring, that was taken away instantly.
And Richard, was that across the country or is that in a certain location?
Nationally.
Nationally, yeah.
It didn't matter if your facility had coronavirus in it, not in it, etc. We were absolutely
flat locked out.
Yeah, yeah. So I left that out. I'm sorry.
Yeah. Okay. Like I said, man, this is tripping me out a little bit. Dr. B and Dr. A, but for y'all, as far as your story and stuff as it's going. And by the way, you have like real doctorate degrees. Is that correct to say that's why you want to be called that?
True. Yes.
Yeah. Right. So what kind of contact, I think we've all seen pictures of windows and birthdays being celebrated, kind of situations. And, I know there's unique, strategies like, we're doing Zoom here, right? Everybody knows what Zoom is nowadays. We got Zoom and FaceTime and, this type of thing. What kind of contact and connection have you been able to have with your mom?
Well, in early April, the AARP had urged the Center for Medicare and Medicaid Services to facilitate some kind of alternative for non-in-person visits, emphasizing telecommunications. But it never happened. And the nursing home kept announcing, to the television and to the newspaper, to the media, that there were telecommunication efforts in place. And in fact, to this day, it's still not in place. And were it not for CNAs, the kindness of the CNAs to allow us to have a telephone call with our mother or to do Zoom or Skype or some kind of FaceTime, we would not have been able to see our mother. However, it has been because of the help of all of the politicians and our constant writing to people that we have been able to see our mother from a distance and just wave to her. And so the telecommunication piece is not in place yet. Dr. B calls there every single day, and you can hardly get someone to answer the telephone at the reception area. We have yet to receive one note, except for one note. We have not been able to find out the condition, the health and the treatment and the care of our parent. And you see, our mother is never worried about social isolation and loneliness because you were there every day to provide her with conversation and socialization. And when we first saw her, she looked as if she had been given some psychotropic drugs. She couldn't hold her head up and she couldn't keep her eyes open. And we asked the staff what was going on with her. And we believe that these people were being given some kind of sedation so that they wouldn't cause any trouble or be of any trouble during the course of the day, because we understood that that all of them were isolated, that all of their doors were closed, and the only time that they had visitors were the staff members coming in and taking their temperature.
The other
Wow.
piece, Chris.
Yeah,
The other piece,
I'm here. I'm still kind of getting speechless, Craig, and I just looked at each other like, what? Yeah, go on.
yeah, and part of it too is that because it was a short staffing, New York really doesn't have any regulations for that. So prior to the pandemic, staffing and short staffing was always an issue. And now we're looking at people who were now left in their rooms. For example, if you had 50 people in a wing, that means that there were 50 rooms or 35, 40 rooms that the certified nurses, that's what CNAs mean, had to attend. You can't feed all of those people in an hour. Sometimes the food would become cold. And if they put the food in the tray in the room, the person might not have been able to lift the tray or even eat. So now you begin to see malnutrition occur. You begin to see dehydration occur, which was rampant before the pandemic. So you start having all of these issues. You have doctors that are not maybe attending to the patients and the residents like they should. And of course, during the pandemic, the doctors have some fears about walking into a nursing home that has no PPEs, that has no soap, no towels, no hazmat. So everyone is stressed out. This whole issue has created tension and trauma, fear, anger, angst, and everyone is upset. And then we still have, in terms of the medical doctors, we're still dealing with their own paternalism in terms of how to treat patients. And that's a major issue also.
Yeah, I'm just sitting here thinking, and I'm like, and maybe, Richard, this is a question for you, but, for you two doctors, right? Like, what about medical power of attorney? I mean, if I'm sitting there and I'm just thinking about this, like, I'm medical power of attorney for my mom, right? Like, hey, I want my information. Like, tell me what's going on. How does that work?
Well, you can't get in the building either. And you might get an answer on the telephone if you try to reach somebody, you might not. You're in the same category as the rest of us. You might have legal standing to try to do something about it, but this is a captive population that basically is just being attended to depending on what conditions there are in the nursing home. So your legal standing as a power of attorney is no different. I mean, you could still do financial stuff depending on what kind of power of attorney that you have. But, I thought of the quote that I won't state who made it, but early on in the pandemic, I think it was said at the highest possible level that never should the solution be worse than the problem. And without question, without a doubt, in a nursing home, their response or their attempt to create a solution for hundreds of thousands of nursing home residents. There's over 1.5 million residents in the United States of America in nursing homes, and the majority of them do not have the virus. And for all of those people, the solution that they're seeking by the lockdown and the lack of available resources and the lack of any services is creating a problem much worse for hundreds of thousands of residents than the virus itself. The same lockdown that we're talking about and the denial of visitation and et cetera, exists in any facility regardless of whether they have COVID or not. You can have 0 infections, 0 staff positive, all of that. It's affecting every single nursing home resident in the entire United States of America.
Yeah.
And Richard and Chris, one of the things that the question that arises with all of this is, are the residents in the nursing home, do they become property of the nursing home facility?
Oh, no.
I mean, because they don't want the family members to comment about the kind of services or doctoral services or medical services. They certainly are not telling you about the treatment that your loved one is receiving. They're not saying anything. They're not giving a weekly assessment. They're not saying how, what treatment or what care Is the resident losing weight? Is the resident gaining weight? Is it necessary for the resident to go into the hospital? And the issue was also that so many people were dying in the nursing home, and the nursing home administrators were not calling up the resident family members to even let them know. So you began to hear about, some people said it was maybe 10 bodies in the nursing home, and come to find out there was 40 bodies in the nursing home. One nursing home said there were 19. They found out there was almost 100 bodies in the nursing home. So here you begin to find out that there's so many unscrupulous things that are going on in the nursing home, and at what point is the family members, are the residents' family members contacted, and what kind of hold does the nursing home have on those residents? It's like they become property of the nursing home facility.
So Richard I'm sorry, go ahead.
No, I was just going to say that there is, even out of 1947, the Nuremberg cases say that we're supposed to have informed consent of the human subject is essential. Now, I am a proxy. I'm the proxy for my mom. Now, and beyond the health proxy, I filled out the old proxy papers would go from A to Q, and my mom had to initial each and every one, and it basically your power of attorney for the living will. And the nursing home does not even adhere to that or respect that for the most part. So we're not covered by a universal law. We see collusion by the government, by the doctors, by big pharma, and we see that public access to some of the things, the pharmaceuticals, the drugs are high, and it becomes a real issue and a real concern as to what are your beloveds getting? What kind of treatment are they getting? And the other side of it is that what are they eating? Are they eating a nutritional meal? And very often they're not. They're not getting sunlight. They're not getting the ambulations that they need. Everyone needs exercise, even if you're on not only a ventilator, but a respirator. Everyone needs sunshine. Everybody needs to get air and rehabilitation, ambulation, exercise. And there's all kinds of excuses that could be given to the families, especially if they don't know, and their beloveds basically are dying on the vine. It's tragic, and it's all it is collusion.
It's beyond tragic is the way I'm feeling. Richard, is this now? You guys, you ladies are in New York City epicenter, right? I mean, is this what Richard? Would you say kind of characterization with the bodies and the deaths and that type of thing across our country, or is this possibly because it's being hit so hard in New York? Do you have a sense of that?
Yeah. We've been having weekly calls with all of the different ombudsman programs in each region of the country. And so I've been hearing horror story after horror story after horror story. Fortunately, the devastation that New York City has experienced hasn't been duplicated around the country. But the death rates have been, as I mentioned before, in some states, the death rate for the entire state, over half of it is for people in nursing homes. But so basically what you're hearing to different degrees is universal. People being subjected to conditions that are just humanely unacceptable.
Gosh, and is it fair to say, that's not even, it's not even COVID deaths. That's can we say that that's like COVID fear reaction related deaths?
Well, it's interesting you bring that up. They're trying to get all the data and the statistics, and they're doing all the research. But in my opinion, you've touched on one of the most fundamental problems that exists today, and certainly fits in with your viewership and the roles of mental health and therapy people, and that is the detrimental impact that it's having on people's mental and emotional status on a day-to-day basis. Is something that's not being measured, and we're beginning to hear Some of the programs around the country have actually heard from clinicians themselves about noticing the obvious deterioration in people's overall condition and health. And you have to wonder how many people have died who were vulnerable to begin with, who needed certain kinds of supports to maintain any quality of life. When those were removed, what was the impact on people, and what has it been, and what will it continue to be? They're going to start opening up, quote unquote, nursing homes as we speak, but it's going to be done in phase 1, phase 2, and phase 3. Phase 1, ombudsmen are still going to be categorized as non-essential. But eventually, when we're able to begin to go back into the facilities, and for your viewers, this is why we reached out to Chris in the first place, we have no idea what we're walking into. Imagine for anybody subjected to that, and then take someone who has a level of dementia, Alzheimer's disease, may not even begin to understand at all what's happened or why it's happened. What kind of conditions did they develop over a long period of time? How can we be instrumental in trying to hopefully bring about some kind of positive resolution for those kinds of people? And on top of that, the impact that it's having on ombudsmen, period. We have a lot of folks, ombudsmen, seniors themselves, and they're afraid to go into the facilities. It's a really difficult situation, but it's definitely nationwide, maybe to differing degrees, and New York City clearly has been the epicenter.
Yeah, it's a buzzsaw. I mean, I'm just sitting here thinking, the psychological realities here. I mean, my brain's buzzing. You got the lack of sleep will cause someone to become psychotic. That's why it's a form of literally of torture techniques. Torture techniques also psychologically involve isolation. You think of solitary confinement. That's specifically designed to break people down. The lack of sunlight, Dr. A, I think you had mentioned, I mean, that's purposely used to break people down and to break down on the basic fabrics of your psychological, not even health. I'm going to be clear, from my clinical brain in the psychological field, your psychological ability to function. We're not even talking about quality of life and mental health we usually talk on the show. We're talking about psychological survival, really.
Correct. Yeah. No doubt about it.
One of the things that we have been looking at is that when you've given so much love and so much protection, and the resident feels safe, and the knowledge and awareness that they have been loved, can you imagine having all of that pulled away from you, and so that it no longer exists? So what happens? You weren't fearful, but now you're fearful. You have your sense of self-worth diminishes because you don't know who's around you. You don't know who's coming in to watch you. Folks say, well, why don't you take your mother out and put her someplace else? Where can we put her?
Yeah, I was going to go there because that is something people are going to say, well, hey, why don't we just take them out of here? Bring them home. Can you speak to that? What's the reality there?
The reality is that if she weren't in that condition, she would be home in the first place.
Right.
And so people are not thinking about that. And the first day that your aide doesn't come in, and the first time that you have to clean up defecation or urination out of the bed, and then try to shower your loved one, now all hell breaks loose, because you can feed a person, you can dress them, but that showering and bathing and taking care of their personal needs, that's a biggie for any one person.
Yeah,
And
go ahead. I'm sorry.
Yeah, but the family's intervention, see, it's the three-pronged situation. You have the facility, you have the administration and the social workers and the directors and dietary and nursing and even your security, but you also have your family, and your family is the integral part that roots it all together. It's a three-pronged situation, and we have to understand that. And what happens is that the family keeps a check, because these people are not doing that kind of checking. First of all, there's a sense of unpreparedness, lack of proactive thinking, And then you have emergency, which is what has been the case for all of this disease and condition. Now, not only are we dealing with the viral pandemic, we're dealing with a racial pandemic. There's so many things that are going on right now. And so people are stressed out. They're in trauma. And that's everyone, because what we saw in 2019 is radically different from what it is right now. So we're not looking at the age quake, the whole sense of the aging population getting larger, and everyone knows that. And what happens is that once you knock out a demographic, you knock out collective knowledge. And we have lost thousands of essential people. For what? I'm telling you, this was genocide, this was an extermination, and this is all unacceptable. This is mismanagement, misleadership, miseducation, and misalignment. And this is just horrendous. And I'm wondering where the lawyers are. I'm trying to figure out, are they dead? These are unlawful deaths, illegal deaths. Would you bring someone sickly into your home? No, knowing what the pandemic is. This is all unconscionable and inhumane. This has been a horror against, and the genocide, what is genocide? Genocide is a crime against humanity, and that's what this has been.
So I'm curious, ladies, have you been able to, part of what I understand about mental health, and there's a whole therapy theory, called constructivist theory. And it's about, being able to tell your story, and stories are really important in healing and recovering and managing all of this. Have you, I don't even know how to ask what I'm trying to ask. Have you been able to tell your story? Like I hear it in your voice, and I hear you talking about these atrocities and events and the realities that we're facing. Have you been able to tell your story other than to each other, like to family or to neighbors? Like how have you been able to get the word out? Have you tried, and what's that looked like?
We've had the word out, and we've been in media, and my sister and I have kind of spearheaded interest in the stories about the lack of communication venues available for the residents and the deaths. Even this whole piece of how the funeral directors have to interface with the nursing home. There's just a lot of issues that no one is going to touch on, because it's not only is it touchy, hot topic, but hot topic. Yeah, they're hot topics. I mean, the price gouging and the cost of trying to get a grave, the fact that only 10 members of the family can come to the funeral if there is one, and then it has to be a virtual reality. Then that's a month. Then if your body goes to a cemetery, that's another 3 weeks before it's even buried. So it's on and on. So are we telling our story? We're telling you our story.
Yeah.
And we have gotten our story out through the media and on the radio, and certainly our friends who are journalists, have been interested in the story, and they've taken time to hear about what we're going through. But it's not just us. It's a major piece, and they found out that a lot of other people are going through the same exact thing that we are, and it's nationwide.
Yeah, it touches my heart what you speak of, Dr. B, I think that was, right? That is, ladies, that is hard to tell. I'm not going to lie to you like I was afraid. Recently my sister just died, and we did an episode in honor of my sister talking about, if you want to check it out on this show, it's Chris's personal story is what I think we titled it. And yeah, that's okay, and thank you for that. But I mean, one of the things that really we talked about is the the complicated nature of dying, right? Like under normal situations, I chronicled the first time in my life I'm sitting down with my mom and my wife and my stepdad, and we're like having these crazy conversations. Like, you're not prepared for that. You're not ready to have the conversations about well, how much money do we spend on this, and what coffin do you get, and where do you do cremation, and how do you get this lined up? up for a a viewing, and what do you do with the invitations? Do you do invitations? Is it an invitation? What do you do? Is it you are not prepared, is my point, to deal with under normal circumstances, right? Like the bombardment of emotional issues that literally happen within hours or minutes, really. Actually minutes by the time I found her and we were at her apartment. You're now faced with this. I can't imagine that, honestly, in the face of, like, oh, wait a minute, by the way, you can only have 10 people there. Like, what? What?
If I could add kind of to, sorry if I'm interrupting one of the doctors, but I think it's important to mention that when you talk about telling your story, this is a story we all need to tell. This is a story that we as a culture and a community need to tell. And my fear is this been in the headlines. It's been, talked about nationally all around the context of COVID-19. And my biggest fear is that when things start to settle down around this, people are going to be operating from the horrible misperception that things can just go back to the way they were. They can never go back to the way they were. And we as a culture need to say never again. And it's going to take people standing up and telling their story and coming together as a community and organizing and doing all of those basic things that we do to bring about other changes in our culture and our society. But it needs to be around this subject. And it's going to take a lot. You mentioned, where are the attorneys? I think Dr. B said. Just to give you an example of how the industry itself is attempting to try to prepare for moving forward, the industry itself, for sure in the state of New York, in California, and I think in 23 other states, they've convinced the governors of those states to grant immunity for any harm that occurs to a resident during the implementation of COVID-19 response.
Well, pause right there. Hold on. What? Repeat that again.
Yeah, a number of states, and now they're trying to introduce legislation federally to grant immunity to nursing home and long-term care facility owners and providers against any harm that occurred during implementation of the COVID-19 response. And that is absolutely, I'm glad to see you shaking your heads.
Dude, man, yeah, I'm shaking my body.
Outrageous. Yeah.
Has it already been done in some cases, Richard?
Oh, yeah, absolutely it has. Yeah, New York has granted it. It's been granted at the state level. California, surprisingly, has it. Last I heard, I think there's 23 states that have granted some level of immunity to providers for harm that occurs during the COVID-19 response.
How is that even possible? I mean, somebody needs to be held accountable. I think that's one of the problems with our country is people get let off the hook. And this is certainly a situation where that shouldn't happen.
I think
I second that.
One of the political things that's going on is that the nursing homes are corporations. And we have to remember that the corporations have been providing the elected officials, they've been banking them. They've been providing, coffers for their bank accounts, and for their election campaigns and everything. So what happens is there's a payoff here.
Mm-hmm. Oh, it's big business.
I think it's also a combination of a misunderstanding or misperception of what the virus has actually done and caused, and with just kind of this automatic sense that they can grant license, can grant license. Same thing when they removed all the regulations pertaining to nursing homes. They felt like that was justified because of the fear connected to the virus. And the same kind of mindset applies here, that the argument by the facility operators is we can't be held responsible for something that we have no control over, that is at this magnitude, that is causing this level of disruption and death. And so it makes sense to grant us immunity. And the policymakers, because they don't understand the full context of what is happening, are granting that kind of immunity. It's based on a fundamental level of ignorance by policymakers and elected officials as to what really goes on in long-term care. And when I say we as a community need to come together and tell our story, that's exactly what I'm talking about. Because policymakers that understand the true reality of what's happening in long-term care facilities would be shaking their head just like you and I are when they're talking about granting blanket immunity. So,
right.
yeah.
And
Yeah, I
Chris,
think it's something.
Chris,
Go
I
ahead,
just want
Dr.
to add
B.
one thing.
Yes, ma'am.
They not only, we have to look at the Department of Health, and the Department of Health has been complicit in making rules that are not good. And this is what we've seen from the Department of Health. It's been gross neglect. And one, not to test it, even from the corporatocracies, they have not allowed the staff to be tested. And there are a lot of things. The owners of the nursing homes are also complicit. The administrators, the directors of nursing, and especially the Department of Health. And the Department of Health has a very bad habit. You send them a concern, and they will tell you it was unsubstantiated. Partly comes from the fact that they didn't do things in a timely fashion, and they also didn't use science, expert science. They let someone make some decisions, and it was a proliferation of ignorance. And it's unfortunate that all of these people had to die, and it's very possible because of the immunity measures that will be extended to the nursing home corporates, they're going to get away with murder. And I still contend genocide, extermination of a most valuable demographic group.
Right. You know, since the beginning of this pandemic and the realities that we face, and I've been calling for 3 simple realities. 1, we need prudent decisions. 2, a calm attitude so that fear and shame aren't driving the ship. And then 3, awareness, so that we're not allowing ignorance or avoidance to, drive us away from the prudent decisions and such that we need. And I tell you what, guys, I mean, the fear-based reality that I'm seeing in some of these policies and some of the behaviors and some of the decisions is profound. The shame-based reality that I see in the way that nursing home care facilities are being operated, to save their name or their namesake. The avoidance that is profoundly in action is just, it's all astounding. I mean, we're not making prudent decisions here. Craig, you had a thought that I don't want to lose.
Well, I was just going to say about the story. I don't think that the holistic story is out there because, on the news I've heard, I knew that nursing homes were hotbeds and that, I think I heard today 48% of the deaths in New York had been in nursing homes. And I did hear about a nursing home who had a large number of bodies. But the holistic story, thinking about the doctor's mother there by herself and them not having access to her and locked up in the small room and potentially drugged and no exercise and it being a nationwide problem. When COVID first started, that rest home in Washington was hit really hard. And that was like the big thing at the time. And then again, the situation in New York, but you don't hear about the overall things like I'm talking about. And when you do hear something, it's a soundbite. It's not the overall story. So hearing you guys talk has really enlightened me, and made me angry too.
Yeah.
And that's the story that people need to hear, the whole thing.
Yeah, the other part of, and not to interrupt, but I really appreciate you saying that. But the other part of the story that needs to also be mentioned is that the CNAs and the staff working in these facilities, they're frontline workers as well. They are literally putting their lives on the line, just like people in the hospitals are, except they aren't being provided with PPEs. They aren't being given the tools that they need to do their job. And yet they're showing up for work every day. And most of them are working for minimum wage. A lot of them are. There's good-hearted people that are out there busting their tails to try to make a difference. And we need to acknowledge that before we would ever end our discussion tonight, for sure.
Richard, I'm glad you said that, because there's always multiple angles to things, right? And if you look deep and you look with an open mind and an open eyes, you're right, because these folks are working, and they've got to be overrun, overwhelmed. I mean, the mental trauma of seeing the bodies and seeing the isolation and knowing, I mean, the sheer power of helplessness to make an impact into people that I mean, these workers see these people every day, and they deal with the grief and the loss as well. It's kind of a nightmare all around.
Yeah, it is. And we definitely need to be all coming together and all supporting each other, from the staff to the advocates to the family members to those people that are dealing with this on a daily basis. And we all need to be coming together to make a difference. And that, in the world of advocacy, that hasn't always been the case. A lot of times we're investigating wrongdoings by facilities or abuse or neglect or whatever, that puts us on a different plane with our relationship with the providers. But in this type of a situation, the advocates, the nursing staff, the CNAs, the family members, the community all need to be coming together, because that's what it's going to take to make a difference.
Right.
Who?
I just wanted to add one thing. There are a lot of people who are on dialysis, and even the people on dialysis are being tested for antibodies unbeknownst to them. And the people, as I said before, are entitled to be informed. So there's a lot of things that are going on, and with people not knowing what is happening to them or what they're subjected to.
Right.
Or what they're being subjected to, And so now as I found out yesterday, the staff members are now being tested according to New York State law. They are being tested twice a week. And I understand from a person that they've been subjected to the very painful nose swab. And we understand that if people are taking oxygen therapy or have a dry nose, if they have nasal issues, that it could cause them to bleed or whatever. So the staff members are now being tested, and it's not an unpainful piece, and they don't like being tested, and now the residents are being tested. But we have said that our parent is not to be tested under any circumstance.
Okay.
Are you able to see her now?
From a distance, just a wave. And we had a lot of troubles with that. They gave us nothing but grief and angst about that. But
my heart goes out to you. It does. I can't imagine how that must be.
Because you're going from daily contact and regular routine living life together to that.
Yeah. Who's accountable? Is it a state thing? Is it a federal thing? If the lawyers showed up, who would they sue, or who would they?
Craig's going to be there, Dr. B, here in about 15 hours.
Yeah, I don't know if we have enough time for that conversation, but
right.
Again, the problems are so deep rooted. Definitely the state, definitely the federal government. But part of the problem begins with the lack of oversight of the facilities in the first place, both at the federal level and at the state level. A good example is that statistics, they did infection control surveys in nursing homes prior to the pandemic, and boy, everybody just got great reports. Everything was all good. They ordered 100, last I heard from the Medicare Rights Center, I think there was 170 nursing homes that were tested mandatory after the virus broke out, 170. And less than like 0.6% of all those surveys found any kind of serious harm. And the rest of the surveys were like, oh, everything's all good. So, we've made numerous complaints over the years as ombudsman. We've pushed stuff up the ladder for trying to get enforcement about staffing regulations, about resident quality of care, around over-medication of people, of use of psychotropic drugs. There's a long list of just have been habitual, perpetual problems in the long-term care communities, and nothing has been done about it. So who's vulnerable from a liability standpoint? Lots of people, in my opinion.
I hear you.
I think that the legal profession could really, but again, you have these immunity provisions. You have courts that make it difficult for anybody to sue. You have corporate structure of the facilities in such a way so that you can't really sue the people that are really responsible. Again, that's a whole nother conversation we could go into maybe on another show.
Yeah.
Yeah. So a lot of people, all of us are responsible. All of us are for allowing it to get to this point. And that's why we're equally responsible for coming together to try to prevent it going forward.
Gotcha. It's funny, man. Our show will be heard, over the nation, and, different states have different things. I mean, it's, in our state we have called ABC stores. What is it? Alcohol, beverage control, something. I don't even know what it stands for, but they're liquor stores, right? Mr. Graves, could you believe that the liquor store clerks are essential workers and ombudsmen are not?
Yeah.
I mean, really.
Nothing amazes me anymore. Nothing amazes me anymore.
Guys, how do we develop hope? We need to taxi in here too. I was kind of saying, let's get you guys together and hug your mom and hang out and get a cupcake and Jesus, how can we develop hope and move forward kind of to get to the other side of this thing,
Well, it appears that for the moment, hope is on hold until we are able to perhaps even touch our mother. I mean, she hears us through the telephone, and we continue to say, we love you, we miss you. And she said, I know, I understand, but she really does not understand the depth of all of this, as we understand it. And we are saddened. We're also a little bit enraged about this abandonment that has been so prevalent in these nursing homes. And really, the nursing home is supposed to be for post-acute care. It's not supposed to be your deathbed. And
right.
Basically, this is what it's been, as well as the nursing homes that have kept so many bodies in the nursing home, and the smell of death has waffled through the vents of the facility. And it's a sad blow. Our mother is a tough cookie, and we are children in discipline of hope, but we just keep praying that she will survive this. We know that she's already taken a hit. She's lost about 15 pounds, but she's still cogent, and she is still aware of her environment, and she still recognizes us. Like we said, we don't know how long, because this has already been 90 days. And before we were told that there was going to be a pause and a lockdown, we were able to see her. And we said, Mom, we don't know when we're going to see you again. We touched her, we hugged her, we told her that we loved her. And she said, I understand, but nobody understood at that point. And we still don't understand, because no one, I guess except for Aldous Huxley and George Orwell, had a clue about how this is going to turn out. Whoever thought that in our lifetime we would live such a life right now, our own isolation, our own solitary confinement, this protestation that's going on, and all of this is cataclysmic. The deaths and the police brutality and the poor judgment on our leader. It only takes one good leader to make a good decision, and it seems like people are kind of fuzzy at this time. They're not making good decisions.
Fuzzy is definitely a word, that's for sure.
Yeah,
you know what? I'm gonna ask you. I want to hear about the tough cookiness, if that's a word, of your mom. And I'm gonna tell you, I'm a proud West Virginian, so I'm thinking of my grandma, who's not with us. She was. I want to honor her. She was an awesome lady that came over the pond from Austria, and I'm pretty sure I can fairly call her a first generation. She was a strong West Virginia woman, and I just see her. She was short in stature, but she was a tough lady, man. Tell me about the tough cookiness of your mama.
What you're talking about, your grandmother and our mother, is a sense of resilience. And what happens is that these folk had a sense of God and humanity and working together with people. And it appears that, again, as I said earlier, this pandemic has taken the face of humanity away. There is just no justification for the way that people have been treated. And I keep on saying this. As a matter of fact, I was doing some work called Elder Disposability and Invisible Genocide. I have to change my paper, Chris, because Elder Disposability, a visible genocide. And it's very painful to see all of the areas that the seniors are being removed. This was unconscionable, amoral, immoral, inhumane. And there's nothing we can do about this because all of our brothers and sisters have gone. But your grandmother and my mother and our mother came out of an era where they were powerful people, and they believed in helping one another and respect and regard. What we're looking at now is mismanagement and misleadership, and we can't get this straightened out. We have a president who believes in violence, and he's created a system, a parent system. People can't hide behind it anymore, of where people don't have any respect and regard for one another. This is not a television show, but that's what it looks like. And he has his biggest audience ever in life. So we're thankful for our mother and your grandmother because they led the way. They gave us a value system and expectations, some high expectations, which we don't see these days. So it's very difficult.
I hear you. I definitely hear you.
Resilience.
Richard, why don't you give us a summary? And I want to kind of we need taxi in here for sure. What do you want people to hear and know? And then I'll go to you ladies kind of as well.
Oh, I appreciate you doing this show, and I think the most important thing is just to get the word out there from those who are directly impacted by what's going on out there and help people to understand. But I also wanted to comment, you asked about where do we find hope? And I have had the benefit from talking with programs all around the country that there are examples of people finding hope. A number of communities have held neighborhood parades for people in nursing homes, and they big signs, and they do everything that they can to just continue giving them the message that there is hope and you are loved and we do care about you and we haven't forgotten you. And there's a lot of creative ways for people to continue to do that. I've also heard stories about nursing homes building special visitation shelters out on the property and allowing people to go outside and to visit with their loved. It varies from state to state because how restrictive one state might be different than another.
Right.
There are ways to find hope. And also, I have to touch on what Dr. B just said about finding leadership. There has to be a community that comes together around this subject, and we need to have some champions. And we need to have some champions in the right places, elected officials, public safety people, law enforcement, you name it. We need champions from all those different walks of life to step forward and come together and try to find some solutions as a community, because we can't go through this again, and we need to make sure that we don't. So thanks a lot for having me. I really appreciate it, and you guys got a great show.
Thank you, Dr. B, Dr. A. What's the last thoughts that you would like to have people hear?
Well, I'm concerned that the nursing home industry can get some of these poor regulations regulated in favor of the residents. The residents shouldn't have to come up to the level of the nursing home. The nursing home should take care of the issues and needs of the residents. And I think the legislators, either they are going to do the right thing and change the laws and make laws that will help the residents in nursing homes, or they just need to get out and we need to elect some new officials in, because this has a lot to do with legislature that the nursing home has been able to glide by and really not pay attention. You know, and I think that's one of the issues. And there's one other thing, too. My sister and I have been very adamant about the seniors being able to vote. And so right now, we have little faith in these mail-in ballots, but we would make sure that when the people came in, because there was a time that the nursing homes weren't even having these people from the election the booth, the department to come in and make sure that the seniors were voting. My sister and I had to get on the legislators and the elected officials to do something about it. So now this is very important, this particular election. What's going to happen? Are these people going to allow people to come in and let these residents vote? Are they going to allow the residents to sign the papers, because they weren't doing it on their own? So it's a big problem, and the number of people who are still left in the nursing home, what are they going to do about this voting situation? Because, again, this is their right to vote.
Listen, my vote would be that their vote counts for 3 votes. How about that?
That's right. That's right. And I think the last thing that we could possibly say is that we have to deal with this whole sense of ageism and respect and regard to be given to seniors. We need to have more gerontologists, more service providers, business representatives, community and church leaders to develop and just some astute people to develop policies to prepare for this expanding age phenomenon. And we should be perceived as enlightened and creative and worthy, and not decrepit and senile and confused. And that's how we stereotyped. And this is unfortunate. So we're not worthless. We're not useless. We're not sad and angry. But some of the situations that have been created have fostered this stereotypic and ugly idea, and ageism is quite serious. And I understand 67% of the people are affected by ageism, and we have to do something about that, just like we need to handle racism and neo-colonialism, classism, ageism, sexism. We have to attend to our elders. Thank you, and we appreciate your allowing us to speak on this forum. And thank you so very much, Chris.
No, absolutely. It is way beyond our honor. Listen, I started a tradition on this show because I think when people are sharing, it's important to recognize the courage that it takes to do such a thing, man. So when people are live with us, we do a high five. So I'm going to count us down to 3 here in a second. I'm going to say 1, 2, and then on 3, I'd like to ask all of us to clap, signifying a high five and the courage that it takes to do this. Because I'll tell you, it really is. It's a big deal. I'm honored to have you guys on our show to be speaking so powerfully and passionately about, Craig likes to talk about the greatest generation in our nation, and these people that we're speaking about deserve the utmost respect and power to what's going on. It's been very enlightening, and I think honestly, ladies and Mr. Danford, one of our better shows insofar as the power of the emotion here. So let's do a little high five, a clap, if you will, when I count to 3. 1, 2, 3. All right, man. Good deal. Mr. Graves, I'm gonna give you the last word to take us out of here, because I'm still kind of speechless, brother.
Yeah, I'm not sure what I can add, man. I'm not sure what I can add. ThroughItTherapistIs.com, folks. You can find out more about Chris and I on our show. We have individual entries for each podcast. You can also find us on just about any podcast platform and on YouTube. Be sure to follow us on social media. And what's next, Chris?
I'll tell you what, listening audience, if you ever shared one of our shows, I want you to share this one. You pop that little arrow and you send it to your friends. You send it to your aunts, your uncles, your cousins, your brothers, your sisters, everybody, man. Get this stuff out, all right? This one's an important one. We love you guys, and we'll see you all next week.